fortunate to find Martha, and she was able just to help me and my wife get on Medicare. And she's been a friend since, and we have spoken on and off for about the last year or two, and finally decided that this would be a perfect opportunity to help our patients. So Martha is very special to us in the foundation today. A couple of quick notes. We just want to remind everyone this particular call will be recorded. So at some point, this will be up on our website. This was not like one of our patient support groups where we felt that that would be totally proprietary. So just think about that. If there's a personal question that you would rather not share, hold it back because Martha is more than willing to speak to you at a later date. I want to mention that the questions should be put up in the chat if you can during Martha's presentation. And at the end of Martha's presentation, she'll address all of the questions. And if we don't get to them all, Martha is very open to making sure that she answers all of them at later today or tomorrow. Miranda will be moderating tonight's call, which will be a little bit different. So if Miranda feels that anybody is doing a little bit too much talking and we need to move on, she'll respectfully ask you to move on. But everybody's questions will be answered. And just as another reminder, we will be bringing Martha in for our Arizona walk-in Arizona at ASU. Martha will have a booth there, so if you have any questions or want to meet Martha in person, that would be a great time to come join us for our walk in November. So with that, I would like to introduce Martha, and I am turning the show over to you, my dear. So let it rip.
Oh, thank you so much, Roger. I love being, just a resource for you, and really honored to be able to talk to your folks today. I am very, very astonished and amazed by the work that the Seena Magowitz Foundation is doing. And I know it really is making a difference in a lot of people's lives, because I already have heard from a couple of folks, Roger. You told them to give me a call, and they did. And they're always surprised that I answer. But of course, if it's from you, they should know I would answer. So I'm so grateful. So today, what I'm planning to do is really just do a little presentation about navigating Medicare's annual enrollment period. There are so many layers to Medicare that whether a person is brand new to Medicare because they're turning 65, or somebody is qualifying because of a disability, there's just so many parts to it. I could do 12 distinct presentations. So today I'm focusing on navigating Medicare's annual enrollment period, but I can answer calls about anything else that may come up. I heard someone earlier mention that they have coverage under a spouse's employer plan, and Medicare can work with an employer plan as well, but employer plans are typically quite strong. So when you have a certain diagnosis, an employer plan should cover things quite nicely. If you have Medicare as well, then that's secondary coverage that can cover it even more. But today my focus is navigating Medicare's annual enrollment period. So hopefully everybody can see my slides. I'll be, going through them pretty quickly. But again, as Roger said, if you have questions, I'll answer them. Also, I want to thank Miranda and the rest of the team for putting this together, because it takes so much work to do this. And my role is simple. I just get to talk to you. So whenever I talk to folks, I always have to mention a disclaimer that just lets you know anything that I say is for educational purposes only. And if you want information about your specific situation, you should always reach out to Social Security or Medicare. Now, why does Medicare annual enrollment matter to cancer patients? I mean, it should matter to anyone on Medicare, but especially people who have that diagnosis. It's because a cancer diagnosis can bring new medications, new treatments, new physicians into the mix. And your Medicare health plan is the one that can impact your access to services and costs. So really putting together a presentation specifically focused to people dealing with cancer, in my opinion, is really, really important because the Medicare annual enrollment period is that time of year that allows you to change. Now, for many people, I have this Medicare system maze, and to many people that I talk to, Medicare is a maze. And I've been doing this for about 15 years, and I believe that I have successfully gone through this maze and have lots of information to help and guide people. Just this morning, I got a call from a gentleman, and he said that he had been incarcerated, and that sort of screwed up his Medicare. And I was like, okay, how did you get my name? And he told me that here locally in Hawaii, there's a prison who plays my radio show every Sunday. And that was how he was able to get my name and call me. So anyway, I also like to put up just a couple slides, basic slides. If a person is turning 65 or already there, interesting, you start the process for your Medicare with the Social Security Administration. I put this slide up just so people know there's a definite connection between Social Security and Medicare. I was talking to a gentleman last week, and he has a family member who was diagnosed with pancreatic cancer. So I mentioned to him, I said, have you decided to go ahead and apply for Social Security disability? And this gentleman did not know that that was something that he definitely should look into, because with that diagnosis, it's a possibility that his loved one may qualify for Social Security disability benefits. So, and then if you qualify and you pick up Social Security payments for a certain amount of time, even though you're under the age requirement, which is 65, after a period of time, you actually qualify for Medicare coverage. So a lot of folks don't know that Social Security and Medicare are sort of tied at the hip. Now, when you have Medicare, you qualify due to age of 65 or due to a disability. This is what the card looks like. This is your red, white, and blue Medicare card. But for a lot of folks, if they have coverage through a retiree a plan for Medicare, or they have what's called a Medicare Advantage plan, this is not the card you show for benefits. But I love to show it because I think it's important for people to know that this is the government Medicare insurance card that makes up the core of however you get your Medicare. So Medicare Part A and Medicare Part B are required for most people to start the Medicare journey with respect to the health insurance. So the only folks that don't have to worry about Medicare Part A and Part B are federal retirees. Many federal retirees have the option to take Part A only and still have full coverage. But anyone who doesn't have that federal retiree coverage, you must have Medicare Part A and Medicare Part B to take advantage of any of the options I'll be talking about today. Now, I think one of the things that makes Medicare a little bit confusing and sometimes overwhelming is that when you have employer coverage, as far as I know, any job I held, my insurance did not come in parts. But when it comes to the Medicare journey, you're dealing with learning. There are 4 parts to Medicare. The first part is hospital. Part A is an apple that has its own set of things that are covered, things that are in the hospital. If you've worked for at least 10 years or 40 credits, you get that Part A at no charge. It covers, again, all of your inpatient stuff. But if you were to only pick up Medicare A and have nothing else, if you were hospitalized, there would be a deductible. And for this year, it was $1,676. It changes each year. A lot of people get confused because they don't have just Medicare Part A. They have other insurance as well. So then that deductible doesn't factor in. But it is important to know Medicare Part A has requirements, has deductibles. If you had A only, you would be responsible for those. Same thing when you move over to another part of Medicare, Medicare Part B, as in Bravo, That's the medical insurance, anything that's not in the hospital. So that's going to be your CT scans, MRIs, labs, all those kinds of things come under Medicare Part B. Now, there is a premium for Medicare Part B. The standard for this year is $185, but it's more if you make more. So higher earners pay more. And what's so interesting about our system is they don't look at your income to calculate the higher premium based on this year's income. They go back 2 years. So anyone who is subject to a higher premium for their Medicare Part B, they would look at your income from 2023, and if it was above a certain threshold, you would pay more than 185. I do a lot of presentations, and one time I was doing a presentation for a local hospital. They bring me in 3 months before their doctors and nurses retire. So one gentleman had come to more than one presentation, and he said, Martha, he said, you said my premium was going to be 100 and some change. And he said, but my premium is over $500 per month just for my Part B, nothing else. And I said, sir, I said, wow. I said, the threshold for someone to be charged over $500, your income has to be between $500,000 and $750,000 a year. And he goes, oh yeah, that is where my salary is. So I said, well, sir, you give me the $500,000 and I'll pay your Medicare Part B premium. How about that? Because he just didn't understand that, yes, if you make more, you pay more for the Part B. There's another part of Medicare called Medicare Part C. My son calls that the cable package, also known as the Medicare Advantage Plan. When you have a Part C plan or Medicare Advantage plan, what you have done is you've decided to assign your Medicare Part A and your Medicare Part B to this private insurance company. They wrap all this up and they call it Part C. That can be a Medicare Advantage plan that also will include your Part D drug coverage, and it can be in an HMO, Health Maintenance Organization, or a PPO, Preferred Provider Organization type plan. All of this jargon, all of this terminology has a lot of meaning when you need to get a lot out of your Medicare plan. So that's why it's so important to really understand these 4 parts and how they work. Monthly premiums for these plans can be as little as $0, and some of them can top $100+ per month. Now, when I first started talking about this stuff, a lot of baby boomers and Gen Xers would say, hey, there's no free lunch. How can it be 0? And they're absolutely right. Medicare will not be processing the claims if you pick up a Part C plan. So they pay the private insurance companies. They also pay private insurance companies to have agents to market their plans. So that's why you hear a lot of information about Medicare Advantage plans, free gym membership, free this, free that, because Medicare is paying that private insurance company to administer the benefits. If the insurance company gets more money than what they need to pay out in benefits and to pay the brokers and keep the lights on, then this is how an insurance company can improve their return on investment. And that's what insurance companies are in business to do, to have a good return on their investment. There's also Part D. Now, Part D covers the Medicare prescription drugs. Prior to 2006, if you were on Medicare or a loved one, a grandparent was on Medicare, there was no Medicare prescription drug coverage. So a lot of times people in the past have said, my drugs are so expensive, Medicare doesn't cover a lot. I said, well, before 2006, they didn't cover anything. So I think it's a very, very valuable benefit, and we should really be appreciative of it. Now, monthly premiums in standalone Medicare Part D plans, when it's not part of your Part C, they can range also from as little as $0 to over $100. Now, if I haven't already put you to sleep or confused you, I have a little bit more. A lot of people think that there are thousands and thousands of different Medicare options, and they don't even want to start thinking about it because they believe it's just too much. But the reality is there's only 2 ways to get Medicare coverage. Just two ways. One journey is to pick up original Medicare Part A and B, which I showed you that red, white, and blue card. The very first card went to a former president, Harry Truman, in 1966, my birthday, July 1st, but different year. But he received that card. His wife, Bess, got the second Medicare card. So Medicare has only been around since the mid-1960s. Think about the life expectancy in the 1960s. That program was cobbled together in the 40s, 50s, came into existence in the mid-60s when life expectancies were shorter. So now that we have longer life expectancies, it's really important to understand Medicare. And again, only two ways to get it. So Part A, Part B, then you could pick up a Part D prescription drug coverage plan to cover the drugs. You can also pick up what's called a Medicare supplement plan or a Medigap plan. Same thing, Medicare supplement, Medigap. And what that does is whatever Medicare Part A and Part B does not cover, which would be your out-of-pocket, that Medicare supplement plan will pick up the difference. In many cases, you have a very small deductible and you have zero out-of-pocket for your copay. So for people who are dealing with a condition that's going to require a lot of treatment, a lot of services, they may want to seek care outside of the state that they live in. The Medicare supplement Medigap option is a good one, but people don't hear a lot about that option. We flip to the other side of this chart. There's the Medicare Advantage Plan or Part C. Remember, that's the one that Medicare is paying a private insurance company to administer your benefits. What do they administer? Your Part A, your Part B, and also Part D, and they give a whole lot of other benefits to attract you, like a gym membership, and maybe you can get some prescriptions, vitamins, not prescriptions, that would be included, but maybe you can also get some supplements covered. So the Medicare Advantage Plan, my son, who's 28 years old, he's a millennial, he calls it the cable package, the all-in-one. So the Medigap on the left side, on my left side, is the a la carte plan. You'll be paying that supplement plan so you can get those zeros. But if you pick up a Medicare Advantage plan, the government is paying them so they don't charge you a premium sometimes. You still will have out of pocket, but a lot of folks look at the Medicare Advantage plan as a real advantage because of all the extras. But especially when you have a certain diagnosis, you're dealing with a chronic condition, you definitely will need to understand the differences between these plans. And I say again, back in the 60s when this program was sort of put together, life expectancies were much shorter. So you really have to understand how to get the most out of these plans, because many people that I talk to, they have been on a Medicare plan for decades. My oldest client is 107 years old. So he's been on Medicare since it started. So Medicare is something that people really need to take the time to understand, whether you're there yet or not. Somebody you love, someone you know is on Medicare, and believe me, you will need to make sure you understand it so you can help them. So what are the only Medicare options out there? Even though all the advertising makes it seem like thousands and thousands. One, you have original Medicare Part A and B that you can have with a standalone Part D drug plan. Number two, you can have original Medicare Part A and B with that Medigap plan. That's the one that you will be paying the Medigap plan every month separately, and a Part D plan. And then there's the cable package is number three, Part C. That's the Medicare Advantage plan. They give you a lot of extras. I'm going to show an example of that. That many times will include your Part D drug coverage. You can have that in HMO or PPO. So important to know the difference, because an HMO is restrictive. You can only go to providers that are part of that HMO network unless it's an emergency. But a PPO gives you more flexibility with providers. So very important, if you have a condition where you want to seek the assistance of providers who may not be in network of an HMO, then you gotta look at the PPO. And number four if offered, and I say if offered, because not all companies offer retiree Medicare plan options, but if you were part of a union like the carpenters, electricians, if you were a federal retiree or a city, state, county, firemen, policemen, many times they will have a retiree Medicare plan option. If you have number 4, you do not need to go to seminars and listen to people talk about the public plans because you have a retiree plan. Many times the retiree plans are richer. Once in a while, there may be another option that's a little bit stronger than your retiree option. But once you choose a retiree option, if it's working for you, if it's comprehensive, then every year when the advertisements start to play, you definitely want to only reach out to the advisor for your retiree Medicare plan, because sometimes if you get removed from that plan, you cannot join the other. Now, again, why does the Medicare annual enrollment period matter to cancer patients? Why is it so important to know how to navigate it? Because this is the time of year, if you got a diagnosis in, say, April or May, and you had a Medicare HMO plan, and you're finding out that you're not able to see some of the providers that you would like to, this is the time of year that you get to look at what plans will be offered for 2026, and you can make a change. Now, right now, October, whatever day it is, October 6th, you can learn what the new options for Medicare Advantage plans are for 2026, but you cannot enroll. It's against the law for anyone to enroll you into a plan before October 15th. So this is sort of like the preview period that you should start looking at the options, and you have from October 15th to December 7th to join, drop, or switch to a different Medicare Advantage plan. Now, if you use this annual enrollment period, the change doesn't take place tomorrow. It doesn't take place the first of next month. Any changes that you make during the annual enrollment period take place January 1st. Options are also based on your zip code. I live in Hawaii. I live on the island of Oahu. And many times I'll talk to people and they'll say, hey, I want that zero plan that my cousin who lives on a different island has. And I'll say, well, that same plan is not priced the same on your island. As a matter of fact, it's not even the same plan. Same insurance company, but different plan. And on their island, your island, Big Island, in this case, it's more. You're not going to find the zero plan on Oahu on the Big Island. Same thing in California. There's a lot of zip codes in California, and not all plans are offered in the same zip code. So that's why there's a lot to the process of making sure you're in the best plan for your needs. You have to do a lot of searching. Also, a lot of people get mixed up with Medicare Advantage plans with the Medicare supplement plans and the enrollment period. People think, oh, it's Medicare annual enrollment. Let me change my Medicare supplement plan. But Medicare supplement plans have a different enrollment window, completely different. You don't change every year because Medicare supplement plans may be subject to underwriting. What that means, the insurance company is going to look at your diagnosis, look at your medications, talk to your doctors, and they may decide that they don't want to offer you a Medicare supplement plan, and they are not required to outside of a very limited enrollment window under what's called guaranteed issue. So very important not to mistake this Medicare annual enrollment, which is only for people with original Medicare who want to join a cable package, Medicare Part C plan, or people who want to change drug plans. It's not for people who have Medicare supplement plans. But if you have a Part D plan with your Med Sup, yep, you can change that. But this is not the annual enrollment period for Medicare supplement plans. Now, we're talking about the Medicare annual enrollment that starts October 15th, but guess what? 1, 2, 3, 4. There's 4 additional enrollment periods. I'm not going to spend a lot of time on this, but I just want people to be aware. The other thing that is very confusing when it comes to Medicare is Medicare has different enrollment periods. So people who are just aging into Medicare because they're about to turn 65, there's an enrollment period called initial enrollment period. It has nothing to do with choosing that Medicare Advantage plan unless you pick up that Part A and B. So you will need A and B to pick up a Medicare Advantage plan. There's also something called a general enrollment period. That's for people who missed their period. They can sign up between January 1st and March 31st. The gentleman who called me this morning, who was incarcerated for 10 years, I didn't ask him anything about it, but anyway, he was surprised to learn he cannot sign up for Medicare until January 1st, because when you're in the prison system, you cannot use your Medicare, and most people are not receiving Social Security when they're in prison. So they're not paying their Part B premium because they can't use it. So therefore, he has to wait until the next general enrollment period. He will also have 10 years of penalties because he was not enrolled, because this gentleman is 75 years old. So I had a nice long talk with him, and he said, sounds just like the same Martha on the radio. And thank you, just wanted to confirm what my options were. There's also a Medicare Advantage open enrollment period that will start in January. And there's also special enrollment periods. I get a lot of people who call me and they say, Martha, I moved, but I have to wait, right, until that October through December. I go, no, if you moved, that gives you a special enrollment period. So moving from one service area to another, one state to another, I deal with a lot of people in Hawaii who come in from other countries. I have a lot of different situations with people. They were totally unaware that there's something called a special enrollment period, so they don't have to wait for October if one of those situations apply to them. Now, again, what happens if you miss that Medicare annual enrollment period deadline? There are other enrollment periods available. So that was the only purpose of me going through that. Now I want to start talking about the real meat and potatoes. Now, how do you figure out what you need to look at if you do want to make a change during this annual enrollment period? Well, everyone should have received what's called an annual notice of change letter. That's a document that you receive in the mail that explains the changes that your Medicare plan is making. So that's what you need to look for. But then the next question you have to ask yourself, will you tackle reviewing your options yourself, or will you use a licensed agent? Now, I noticed when I used to work with people, I would say born in 1950 and prior, they really like sitting down with an agent, spreading their paperwork on the table and really giving information to help the agent help guide them. What I find today is a lot of baby boomers and Gen Xers, they will see somebody sitting at a table at a pharmacy, ask them some questions, and it seems like they attempt to make a decision that way. Also, some of them may go to a seminar that's offered by their bank, their credit union, the library many times will offer these. They will go to a seminar and attempt to learn information about what to do. However, I find a lot of the seminars are very broad. People sitting at the pharmacy are good if you can make appointment with them to do one-on-one. But how much information can somebody really give you sitting in the lobby of a drugstore? Also, I find that some people are reluctant to work with agents. I would say agents, I have an insurance agency myself, and I have 5 agents, including my son, 6. I have 5 agents that work for our company, and I train them to be patient, kind, and great listeners. And they will not steer people wrong. I let them know if you do, you'll be dealing with me, and they don't want to do that. So it's really important if you can find a good agent. It's important to work with that agent for helping to guide you and also after service when you're trying to navigate Medicare. But I notice a lot of Gen Xers, they want to do it themselves. And I noticed the baby boomers, they feel that they can go to a TikTok video and learn everything they need to know, or YouTube, or watch a video, and they know everything they need to know. But this Medicare information is really fast changing. So you really, really want to get a good understanding or have a go-to person that will answer your questions. So what needs to be done if you decide to do this on your own, or even if you work with an agent? You first need to really look at that annual notice of change. That's going to show you what the cost of your prescription drug plan, what that looks like, and what it is now and what it will be for next year. So you really want to get a list of your prescription drugs. You always need that. You need the frequency, you need the dosage. And the reason you need the names of the drugs is because some of them, the names are so similar. If you're just doing it from memory, you might provide the wrong prescription drug and look up the wrong cost. Also, your key providers. Always have a list of your current primary care doctor, your specialist. Have that available so it's easy to check if they're in the network or out of it. Also, be aware that sometimes there's prior authorization, step therapy, or restrictions on certain drugs or treatments. Also, what are the out-of-pocket maximums? You might want to just make a list of all these things so you know this is what you're looking for when you're trying to make an informed choice. So how will you know if there's a more suitable Medicare Advantage plan or drug plan if you don't have your list of drugs, you don't have your doctor's names, and so on? Also, it's important to investigate whether you qualify for programs like Extra Help or low income subsidies, or sometimes even Medicaid. I've talked to people sometimes, this is with a breast cancer diagnosis. The person had to leave their job, a single woman, she had to leave her job, so she had no more income. And this person never ever thought they would need to take advantage of their state's Medicaid program, but they were able to do that. And all of the costs for their care, for their breast cancer treatment, was covered 100%. And I tell folks, remember, your taxpayer dollars pay for Social Security, Medicare, and even Medicaid. So if the time ever comes that you have to take advantage of this program, don't feel like it's a handout and you didn't do enough to earn it. You absolutely earned it, because most of us have been paying taxes all our lives. Now, I wanted to include what this annual notice of change actually looks like. And this again is for just people with Medicare Advantage plans, either that Part C cable package, or if you have just a standalone Part D drug all by itself. The summary, the annual notice of change, is going to tell you what is changing in the new year. So that's going to be a lot easier to read than the whole booklet. So in this particular case, and I tried to take off the company that's represented, I hope I did that okay. So in this case, this is for a Medicare Advantage plan that includes drugs. So here it's showing that the monthly plan premium is going to remain the same for 2026, 2025 this year, 2026 still zero. The maximum out-of-pocket amount from network providers, 6,700, staying the same. If you see doctors in and out of a network, combined 10,100, so that's staying the same. Looks like primary care office visits are staying the same. But if you look at the specialist visit and the inpatient hospital, specialist office visit, it is $40 in 2025. I hope everybody can see it's $60 in 2026. If you look at the out of network, that means this is a PPO plan. So you can see doctors outside the network, but you see it's a lot higher, $75 in 2025. It's going to $95 in 2026. Now let's take a look at the hospital stay. If you have an inpatient hospital stay under this plan, you're paying $315 in 2025 for the first 4 days, but 2026, that's jumping to $550, $550. If you see, if you need to be hospitalized, look at this, at a hospital that is outside of the network, 40% of the total cost in 2025, same thing in 2026. But definitely when you have even a PPO plan, it's great if you can find doctors in network because out of network can sometimes be more. So you see, that's why it's important to make that list of your providers, your PCP, any specialists you see, so you can pinpoint what your costs will be. Now, what else can you do during this annual enrollment period? Now I'm speaking to the do-it-yourselfers out there in the audience, or if you know someone like that. Again, same thing, like if you work with a broker, you have to gather your information, your current plan documents, but now you can go to medicare.gov. I hope you're writing this down, medicare.gov. You can go to medicare.gov and you can actually do your own plan comparison. It will allow you to put in your zip code and you can look at everything that's available. You can compare at least 3 plans at a time, and it will let you know which plan is going to cover your medications, which plan covers your providers. So you'll be able to check everything you need to decide whether you're going to stay with what you have or maybe switch to a new plan. You would submit your enrollment. Medicare.gov also lets you submit the enrollment directly through their site. You don't even have to call the insurance company. And again, any changes that you make will become effective January 1st. This is the Medicare Plan Finder, but this time it's doing a lookup of your medications. So with this Medicare Plan Finder tool, you can actually put in the specific name of your drug, and it will tell you exactly based on the plan you choose. And in this case, we used Humana Choice. That's a Medicare Advantage plan. You can put your drugs in, and it will tell you exactly how much your drugs will cost in the new year, 2026. So again, without really going through all of this, you really are just guessing. If you just listen to somebody says, oh, this will be a good plan, they really should be going through this whole process with you, or they should do it and get back to you. But they should be looking at the drugs to make sure they know how those drugs will be covered. Now, this is just a nice visual of the Medicare Advantage plan. That's the cable package. So remember, your A and B is in there, your drugs, hearing benefits. Many times they'll offer dental coverage, vision, and it's an all-in-one plan. You'll show one card. You won't show your Medicare original Medicare card. You show one card that comes from the insurance company. That's the Medicare Advantage plan. Then there's also, remember, the Medigap plan. That's the plan that you will show your red, white, and blue Medicare Part A and B card. You'll show your Medigap plan. It will fill in the gap, and that should allow you to put more money in your piggy bank. But I don't think people have those anymore. But it actually allows you to reduce what you pay out of pocket. I have people sometimes who are, not well when they're retiring from work, and they know they're going to need a lot of treatment, a lot of services, a lot of scans. No one talked to them about the Medigap plan, and they were thinking of choosing the Medicare Advantage. But what they learned with this Medigap plan is they can see any doctor anywhere in the United States that takes Medicare and will take them. There's no networks to fool around with because you'll be paying the premium for the Medigap plan. Medicare will pay their portion first. The Medigap plan will pick up the deductibles and the co-insurance, and then you will have the least amount to pay out of pocket if you have a lot of services. Now, what are some of the common pitfalls? And I don't know if I did a good job of how to avoid them, but I'll go over a couple of the common pitfalls. So a lot of people are not aware of changes to the drug coverage within their plan. Now, again, if you're working, if everybody on this call is working and covered under an employer plan, none of this comes into play. All of this comes into play when you're dealing with Medicare. And that's what I think is also very overwhelming to people. They never had to worry about this before. But once you go onto a Medicare plan, every single year, you want to look at that plan and the formulary, which is the list of drugs, but you also want to pay attention to any notice or email you may have gotten that there's been a change to the drugs covered in your plan. I was working with someone just recently, and she said, Martha, my Prolia they're telling me it's not covered. So I said, I saw a bulletin that your particular drug plan is no longer covering this drug called Prolia. They substituted it for another drug. I call it Jumanji, but I think it's Jubonix or something, but I can only think of Jumanji. So anyway, I said they're substituting that. And she said, well, nobody told me. And I said, wow, they should have sent you something. So it did turn out that she had received, she's set up to get everything electronically. So she got a little notice to go check a message, from your health plan. So there it was waiting in her message portal of her health plan. And it did say there was a change. So no problem. It turns out this has a happy ending. The new drug is 50% less than the Prolia. So she was very happy that she'll be able to pay less for that drug. A lot of people also are trying to deal with, making choices when their health is not so good, or they just feel completely overwhelmed by everything else going on in their life. So that's why it's really important to at least know what to do. And maybe you can, get some, family members or trusted friends to really help with this process, because it's really not easy once you really start needing the benefits. Choosing plans solely by a premium is not always the best. A lot of people assume that a higher premium means better benefits, not necessarily, and vice versa. Sometimes you do need to pay more to get more. Sometimes that's not the case. Also, checking to make sure your providers are in network. I had a guy recently, he said, Martha, my urologist, is no longer taking the plan that I have, and I want to stick with him. I have some prostate stuff going on. So we had to work together to figure out what we were going to do. And he basically had to end up changing his plan to keep that particular provider. Also, a lot of people, I see a typo, a lot of people lack an understanding of government assistance or pharmaceutical assistance programs. Those are programs, they call them patient assistance programs. Sometimes they will provide help for very expensive drugs. And I've had a couple folks who really benefited from that. Also, I think some people have been hearing in the news a lot about denials and, prior authorizations and, all kinds of crazy things, and they're not getting the service that they need, or they're not getting things covered as they should. And what I say to folks is that can happen whether you have Medicare or you have some other type of plan. What people are learning, once a health challenge strikes, you really have to look at it as somebody's got to take it up. It's going to be a full-time job, and you're going to have to spend a lot of time making a lot of phone calls, doing research from vetted sources. Don't just look at a TikTok video, but it becomes a full-time job to really get the most out of your plan. Now, another pitfall that I wanted to talk about is knowing who pays first. When you have Medicare, because you're retired, Medicare pays first. Unless you're working, if you're still working a regular job with at a company who has other employees that have active and coverage, you could be retired, but you took another job, that coverage will pay first. But if you're retired, you're no longer working, you're not covered under a spouse that's working, you have retiree coverage, Medicare will pay first. If you're 65 or older, you have a group health plan, coverage based on your spouse's current employment, or your employer has more than 20, your group health plan will pay first. If you're 65 or older, but the employer has less than 20 employees, Medicare pays first. I'll just say that again. This is a pitfall. I had a dentist in this situation. He's still practicing and he's over 65, but he had an employer group plan through his dentist office. He didn't know at 65 he has to get Medicare, even though he had employer coverage, because has a small office, just 5 employees. Once he turned 65, Medicare became first. He did not pick it up, and I had to get on a call with him with Medicare, Social Security, and Medicare to explain that was his situation, and his group plan was not going to pay his bills, okay? The other reason I like to pull up this slide is because I have people who, I had a guy 78 years old, he was still working, he worked for a large company, his employer plan paid his claims first, but then he got sick and he went off on family medical leave. He got protection for his job of 90 days. Turns out he wasn't going to be able to return to work. And the employer said, oh, guess what? We're ending your coverage the end of next week. So he had less than a week to pick up his Medicare Part A and B. Remember, he has an illness, and he wouldn't have been able to get any additional treatment once the employer plan ended if we didn't really hustle to get him his Medicare Part A and B. So we don't have to go through this whole slide. It's just one of the things that becomes a major issue for people. They never imagine leaving work, going on sick leave, and then not having Medicare if they're over 65. But once you're over 65, COBRA, which is the insurance you're offered many times when you leave an employer plan, but if you're over 65, COBRA is second to Medicare. That's the other area where I have a lot of people who get into problems and have high costs because they didn't know COBRA is secondary to Medicare. Now, this next slide, and we're almost done, getting to the end. Medicare does not cover long-term custodial care in a nursing home. Medicare does not cover long-term custodial care in a nursing home. A lot of people think skilled care is, custodial care. Two different things. Skilled is what it says, skilled. So if your loved one actually needs activities of daily living, they will quickly usher you out of the hospital or skilled nursing or tell you $10,000 a day. This is an actual story. I have a dear friend whose husband has Parkinson's, and he needed to go into the hospital for something. He recovered from that, but she felt like he needed to stay in longer, and they said, well, $10,000 a day. And she called me and she said, Martha, I keep telling them I have insurance. And I go, yes, you have a Medicare Advantage plan. It covers skilled nursing, but it does not cover custodial care. That's out of pocket. So cancer-specific issues to watch: the high cost of your drugs, access to infusion centers, radiation, imaging. Will your network include them? What about clinical trials? Are they considered in-network or out-of-network? How is that going to, care for your costs in your plan? Also, if you need to see frequent specialists, you'll have costs for travel. Will that be a burden to have copays for providers that might be out of network? Also, changes in your health status mid-year, that can happen. So you want to pick a plan that you know will care for you for the unexpected. Also, there's always special enrollment periods, so it's a good idea to take advantage of them if you need to change a plan. And there are some folks who know what those are. Also, how does your insurance coordinate with Medicare when the time comes? I mentioned earlier a gentleman who is still working, well over 65. He has an employer plan, so his employer plan pays first. He picks up Medicare because he's over 65. His Medicare will pay second, so he will have those coordinated. What else should you be watching for in 2025? Well, starting this year, all Medicare plans included a $2,000 cap on out-of-pocket costs for covered prescription drugs. That cap will be raised in 2026, but only by $100. So the most you'll pay for covered drugs in a Medicare Advantage plan or a Medicare standalone prescription drug plan, $2,100. So pretty good if they're covered. That's the operative word. When you're looking at these caps, it has to be a drug that's covered. So if you have an opportunity to switch a drug to one that's covered under Medicare, it would be a great idea if you can do that, because $2,000 for this year, $2,100 for next year, that is really good, because you could take 100 medications and they do hold that cap as long as it's covered in your plan. So let me leave you with a real life example. Of course, the name has been changed, but a person was recently diagnosed and she's on several drugs. So she realized that her plan was actually an HMO. And I'll tell you, she picked this HMO because she was in great health when it was time for her to choose at 65. And she was looking at the perks. She was looking at the dental allowance. She was looking at the free gym membership. She was looking at all those things. She wasn't really looking at the protection, because at that time, it wasn't an issue. But she did use that Medicare Plan Finder, and on October 15th, she's going to switch to a plan that covers these new medications that she's taking, also one that covers her specialist. She won't need to get a referral to see the specialist because she's in a PPO, not an HMO, and that plan will start January 1st. So it is really important to take a look at these, ways that you can get a plan that really, really will meet your needs. So with that, I've just left some phone numbers here, not my own, but I think Miranda has that if anybody needs it. But there's the number for Medicare, 24 hours, 7 days a week. I call them at 1 a.m. and they answer my calls, and depends on who you get, whether they give you a good answer. And the Social Security Administration in our state, they're open from 8:30 to 3:30, but you have to find out what the hours are in your area if you're calling your local number. But the national number, 1-800-772, they list their hours as 7 to 7, Monday through Friday. Are those East Coast